Bismillahirrahmanirrahim. Our lecture today about neurotoxicity of toxic alcohols. Toxic alcohols, one of agents have neurotoxic effects, mainly neurotoxic effects. Example of toxic alcohols: ethanol, isopropanol, methanol, and ethylene glycol. Objectives of our lecture: to know different sources of the different toxic alcohols and discuss the toxic effects of alcohols regarding their metabolism and toxic metabolites, effects, mode of poisoning, and manifestation of toxicity with diagnosis. Lastly, plan the treatment regimens for toxic alcohol poisoning. Toxic alcohols, as we know, ethanol or ethyl alcohol is the most widely used one. But toxicity occur long run use or consumption of ethyl alcohol. Methanol is the most toxic with toxic effects within short period of consumption. Propanol or isopropyl alcohol and ethylene glycol or glycolic alcohols. Firstly, we discuss ethanol effects or ethyl alcohol effects. As we know, it is the most widely used alcohol and most widely used preparations present at home and industry and medicinal preparations. Ethanol is a colorless liquid with characteristic agreeable odor مميزة. In dilute solution, it has sweet flavor, but concentrated solutions has burning taste like this. Ethanol produced by fermentation of sugars present in fruits and cereals. Different sources of exposure to ethanol products. First are alcoholic beverages as used by drunkards. Different concentration present in the different beverages. Also, medicinal preparations like cold medicines, cough medicines, and allergy medicines contain different concentrations of ethanol. Also, different forms of mouthwashes containing ethanol by different concentrations ranging from 0.3 to 75%. Different household products present at home: mouthwashes, collagens, aftershaves, antiseptics, glass cleaners. Perfumes are containing different concentrations of ethanol and easily available at home. So the mode of poisoning due to presence of these preparations or sources at home. Poisoning occur mainly accidental in children who play in the products containing ethanol. Also, accidental toxicity, acute toxicity, occurs in addicts or drunkards who drink a high concentration or higher amounts at once. enter in acute toxicity. The main route of exposure, mainly ingestion of the alcoholic beverages or accidental ingestion of the different preparations by children. Also, ethanol may absorb it by skin when used accidentally by children who play with the preparations containing ethanol, like perfumes or antiseptics. Also, when ethanol used as antiseptics or used for the production of vasodilatation in children to reduce temperature. How ethanol induce toxicity? We should know the pharmacokinetics or toxicokinetics of ethanol. Ethanol rapidly absorbed from the stomach and small intestine, reach a maximum concentration within half an hour to 1.5 hours, and also absorbed from the lung when inhaled or exposed to the skin. Ethanol distributed all over the body tissues, following the water in the all tissues of the body. Then alcohol or ethanol metabolized in the liver by alcohol dehydrogenase enzyme with production of the toxic metabolite acetaldehyde, which transformed by aldehyde dehydrogenase enzyme to acetic acid, and then enter the Krebs cycle, changed to non-toxic carbon dioxide and water. Also, other alcohols, methanol, ethylene glycol, and isopropyl alcohol, all are metabolized by the alcohol dehydrogenase enzyme with the production of different toxic metabolites. Methanol produces formaldehyde as toxic metabolite. Ethylene glycol produced aldehyde, glycoaldehyde, and isopropyl alcohol or isopropanol produce toxic metabolite acetone. Then after absorption and metabolism to toxic metabolite, ethanol induce acute toxic manifestations. Acute toxic manifestation as ethanol and other all alcohols are mainly CNS depressants, inducing CNS toxicity besides the other effects on the different organ systems. The nervous system is the main target for the toxic alcohols. Production of manifestation differ according to the blood alcohol concentration. Small blood alcohol concentration induce effect on the frontal lobe. When the concentration increase, effect extend to the parietal lobe, then extend to temporal lobe, then occipital lobe, then cerebellum, who responsible for coordination and balance. Lastly, bones and medulla, which contain the vital centers, as vital centers are affected lastly with the very high concentration of ethanol in the blood. The manifestation here differ according to the concentration. With the increased concentration, the effects more prominent and more prominent on the different areas and vital areas of the nervous system. Diagnosis of ethanol toxicity depending on history of ingestion or history of exposure. Also, from the clinical manifestation, which differ according to the blood ethanol level, presence of altered mental state or impaired conscious level, also indicate CNS depression, presence of the smell of alcohol from the mouth from child who accidentally exposed to ethanol, or from the alcoholic person who ingest a very large amount and passed into acute toxicity. Also, in car accidents or drivers who drink alcohols above the level and may pass into car accidents, diagnosed by portable breathalyzer testing for alcohol concentration. As acute ethanol toxicity induced impaired conscious level and hallucinations and abnormal movements, and these manifestations may be mistaken for acute atropine toxicity. We should differentiate between both acute atropine toxicity and acute alcohol or ethanol toxicity. Sharing hallucinations, flushing of the face, unsteady gait, and abnormal movements with impaired consciousness or loss of consciousness. Differentiated from presence of smell of alcohol in alcoholic, changeable pupil, which is constricted and dilate in with painful stimulation, known as MAC-E1 sign, positive MAC-E1 sign, flushing but presence of sweating, subnormal temperature, slurred speech, tremors, and detection of ethanol in the blood and breath by breathalyzer testing. While atropine toxicity, no characteristic smell, pupil dilated and fixed, skin hot and dry, flushed and dry, temperature high, harshness of voice due to dryness of the mouth, and a presence of purposeless movements, detection of tropic acid in urine, which is the metabolite of atropine. Acute ethanol toxicity treated with supportive measures, mainly stabilization of the conscious level and giving glucose for presence of hypoglycemia, thiamine, as alcoholics, drunkards are characterized by the multivitamin deficiency with mainly thiamine deficiency. Also, decontamination should be done very rapidly within 1 hour or 1.5 hours due to very rapid absorption of ethanol. Also, can be eliminated by hemodialysis when the alcohol concentration above 500 milligram per deciliter. Also, symptomatic treatment for presence of hypoglycemia, electrolyte disturbances, for altered mental state, symptomatic treatment should be done. The acute ethanol poisoning mainly occur in alcoholic person who ingest very large amounts of ethanol and passed into acute toxicity. Chronic alcoholics or alcoholism or abuse of alcohol is a degree which produce problems in health, social relationships, economic status, interpersonal relationships. Addiction characterized by tolerance, psychological and physical dependence. Withdrawal manifestation as the abrupt or sudden withdrawal or stoppage of ingestion of alcohol leads to occurrence of manifestation non-abstinence syndrome or withdrawal manifestation, also characterized by craving or dipsomania known as dipsomania. العطش للألكحول. عطش الألكحول بيتشد ليه و uncontrollable desire for drinking alcohol or drinking ethanol known as craving or dipsomania. Chronic alcoholism characterized by different neurological manifestations known as Wernicke-Korsakoff syndrome due to thiamine deficiency or vitamin B1 deficiency, Korsakoff psychosis, and Wernicke's encephalopathy. And sudden withdrawal or sudden stoppage leads to occurrence of withdrawal syndrome or abstinence syndrome, which need emergency measures or emergency treatment. These withdrawal manifestations occur within 8 and 12 hours of stoppage of alcohol ingestion. The main characteristic of withdrawal manifestation of alcohol or alcoholism is delirium tremens. Delirium tremens occurs 48 to 72 hours after stoppage of ingestion of alcohol and lasts up to 5 days. Characterized by restlessness, tremors, hallucinations, seizures, dilated pupils, flushed face, tachycardia. Also, treatment needs hospitalization with sudden abrupt withdrawal with sedatives like benzodiazepine and barbiturates. The second toxic alcohol is the methanol, which is not widely used like ethanol, but is the more toxic than ethanol. Also is a colorless, watery liquid and present mainly in industry, manufacture of formaldehyde, present as antifreeze, paint remover, varnish remover, household solvent, may used as fuel in زي السبرتاء كان يسمى السبرتو الأحمر وبيستخدم as fuels and may be used by addicts as a cheap substitute for ethanol. Methanol poisoning is severe and may be fatal. Poisoning occurs also accidental ingestion by children due to presence of methanol as constituent of many household products and may be used intentionally by addicts as a substitute for ethanol. Also, methanol is a strong CNS depressant, main toxicity CNS depression, and in addition to the ocular toxicity is severe more than ethanol CNS depressant agent. It is a life-threatening poisoning occur due to production of the highly toxic metabolites as methanol unfit for consumption by addicts and produce highly toxic metabolites. Pharmacokinetics or toxicokinetics due to production of the highly toxic metabolites as it is rapidly absorbed from gastrointestinal tract, also may be absorbed from the skin and may be absorbed by inhalation from the lung. Mainly consumption by ingestion and absorption by the skin as accidental exposure. Metabolized also by alcohol dehydrogenase enzyme to formaldehyde, then by aldehyde dehydrogenase to formic acid, which are responsible for the toxicity of methanol by severe CNS depression, acidosis, and blindness. Even lastly, this may occur. Slow metabolism to formaldehyde, accumulation of the formaldehyde, then transformed by aldehyde dehydrogenase to formic acid with production of formate. These acids are responsible for severe acidosis. Formate may be transformed by presence of folate to non-toxic carbon dioxide and water. So folate is essential for treatment for transformation of toxic metabolites to non-toxic metabolites. Manifestation responsible of formic acid formation with production of severe metabolic acidosis and also production of formic acid with destruction of the optic nerve disc with the production of severe ocular toxicity may end in irreversible blindness. Rapid induction of irreversible blindness. Again, toxic alcohols are metabolized by alcohol dehydrogenase enzyme to different toxic metabolites according to the different toxic alcohol. Clinical manifestation of methanol mainly ocular toxicity and severe metabolic acidosis, severe central nervous depression, dizziness, headaches, stupor, coma, cerebral edema, agitation, seizure, infarcts of the base ganglia. Ocular toxicity, destruction of the optic nerve disc and retina, producing blurring of vision or cloudy visions. Photophobia, decreased visual acuity, snowy storm or snow fields of vision, partial or total blindness, irreversible blindness, sluggish non-reactive pupils, papilledema, hyperemia of the optic nerve discs with production of blindness very rapidly. Also, cardiopulmonary effects occur, gastrointestinal irritations. Methanol managed as it induced severe respiratory depression should be managed emergency or supportive measure. Then diagnosis depending on history of exposure to different sources of methanol, the presence of the clinical manifestations, CNS depression, metabolic acidosis, ocular toxicity. Then investigation by measuring the blood methanol level and basic lab investigations. Then specific treatment. Blood methanol level is essential for prognosis of the case and for treatment of the case. Other lab measures: arterial blood gas, electrolytes due to presence of severe metabolic acidosis, blood glucose and lactates, electrocardiogram, and chest radiogram to presence of aspiration, pneumonia or pulmonary edema. Treatment: in addition to the emergency or supportive measure, we limit absorption by gastric decontamination. Should be done rapidly within half an hour or 1.5 hours. Then prevention of metabolism of methanol to toxic metabolites by inhibition of alcohol dehydrogenase enzyme to prevent formation of formaldehyde and formic acid. Accumulation of the toxic metabolites: if accumulated, we need to eliminate these metabolites and eliminate the parent compound methanol also by hemodialysis. Inhibition of metabolism either by giving ethanol, which compete with methanol for alcohol dehydrogenase enzyme, preventing formation of formaldehyde, and methanol compete with methanol for alcohol dehydrogenase enzyme. Alcohol dehydrogenase enzyme has higher affinity for metabolism of ethanol than methanol, so preventing formation of toxic metabolites of ethanol. Also, more specific than ethanol, fombazole or 4-methylpyrazole or antizole, which is a specific alcohol dehydrogenase inhibitor preventing formation of formaldehyde and formic acid, and is more safer than ethanol, as ethanol itself may add to the CNS depression induced by methanol, increasing or aggravating the intoxication. Also, fombazole has minimal adverse effects. Methanol: prevention of methanol by inhibition of alcohol dehydrogenase enzyme, either by fombazole or ethanol, preventing toxic effects of methanol. As methanol metabolism extended to 4 hours, we should induce the antidotes fombazole and ethanol for 4 days until a complete metabolism of methanol to non-toxic metabolites. Also, hemodialysis indicated for methanol toxicity if methanol blood level above 25 mg per deciliter, and presence of severe acidosis, presence of severe CNS depression, to eliminate the parent compound methanol and its toxic metabolites. Also, cofactors like folinic acid or folic acid leucovorin to enhance metabolism of formate to non-toxic metabolite carbon dioxide and water, which excreted in the kidney. Also, sodium bicarbonate to correct the severe metabolic acidosis. The other toxic alcohol present also widely at home, known as rubbing alcohol, present for as antiseptic and disinfectant, and for sanitation of hands, sanitation of the skin. Isopropyl alcohol like ethanol, but more potent CNS depressant, and present widely in solvent, antiseptic, disinfectant. Also may be ingested by alcoholics or drunkards as a cheap substitute for ethanol. Also metabolized by alcohol dehydrogenase to acetone. Acetone induce also ketosis, not induce metabolic acidosis. More potent CNS depression without induction of metabolic acidosis. Manifested by CNS depression, gastrointestinal irritation, mild metabolic acidosis or ketosis. Acetone produce frothy breath smell in the mouth, induce hypotension and hypothermia from peripheral vasodilatation, induce hypoglycemia in malnourished patients. Induce ketosis without acidosis. Mainly supportive measures, no need for antidote. No need for antidote due to less toxic acetone metabolite. No need for fombazole or antidote. Only supportive measures. Another toxic alcohol, glycol, but it is an alcohol used mainly as antifreeze. Antifreeze to inhibit added to the water for cooling of radiator in cars, to prevent icing of the water for cooling in cold or in icy countries. May be consumed by alcoholic as a cheap substitute for ethanol. Ethylene glycol absorbed rapidly and metabolized by alcohol dehydrogenase enzyme to more toxic metabolites glycolic, glyoxylic acid, and oxalic acids, which induce severe CNS depression and induce metabolic acidosis. Oxalic acid transformed to calcium oxalate, which excreted in the renal tubules, inducing obstruction of the renal tubules and renal failure. Ethylene glycol in the blood, higher concentration in the blood, metabolized in the liver by alcohol dehydrogenase enzyme to glyaldehyde and glycolic acid. These acids are induce severe metabolic acidosis, transformed to oxalic acid. Oxalic acid excreted in the renal tubules bind to calcium, forming calcium oxalate crystals, which blocks renal tubules, inducing renal failure. The parent compound ethylene glycol also excreted in the kidney, inducing renal toxicity. Treatment of ethylene glycol, mainly supportive measures and stabilization for the CNS depression and impaired consciousness. Also, removal from the stomach rapidly within half an hour and 1.5 hours. Also, introduction of antidotes to prevent formation, inhibition of alcohol dehydrogenase enzyme with inhibition of the production of the toxic metabolites, formaldehvdel and ethanol. Also, hemodialysis indicated in severe cases for occurrence of the renal failure. This comparison between methanol, ethylene glycol, and isopropanol or isopropyl alcohol. Also, comparison between ethylene glycol and isopropyl alcohol. Difference between isopropyl alcohol and ethanol. Difference between different alcohols. Thank you for listening.